Hello and welcome to the Sisters for Fitness Wellness Show. I'm Stephanie Gaines-Bryant. Our guest today is Colette McKie. She's with Turning Point Hypnotherapy Strategies and Acupuncture, and you're an acupuncturist by trade.
Yes, I am. I'm licensed in Maryland for acupuncture.
Well, let's begin by thanking you for coming on our program today.
Thank you.
And it's an area that I've been interested in for many, many years. So let's start from the very beginning. What exactly is acupuncture and how does it work?
Well, acupuncture has been called the first medicine because it's the first kind of treatment where people started to look at cause and effect rather than they were being punished by gods, for example. And acupuncture uses the body. And when there's a constriction of flow in our body, we know we have blood and we have lymph. When there's a constriction of flow in our body, that causes pain. And in my work, pain can be physical pain, it can be emotional pain, it can be mental or spiritual pain. And what acupuncture does is it gets that flow moving again so a person can be comfortable.
In other words, the flow moving through the chi? Or?
Well, it's called chi.
Okay.
And the chi, our energy, moves through what are called meridians. And very often the meridians follow the lines of the blood system. And they're like rivers in the body of energy. And when those rivers become clogged up, like in our Chesapeake Bay, then it causes problems. And the problems that we experience tend to be pain.
What type of tools do you use for acupuncture?
Mostly we use very, very thin, hair-thin needles that are all sterile. They're used on a person once, and then they're disposed of just like at any other medical facility.
So in other words, the person is pierced with the needles in different parts of their body?
Correct. And the Chinese, over thousands of years, acupuncture evolved. It was, again, cause and effect. They found that, gee, when something happened here, it helped their hip, for example. And so they determined specific points, acupuncture points, in different parts of the body. And each one has multiple uses and capabilities of changing things within the body. What acupuncture really does is it changes the habits our body has gotten into. And we know that with some habits, they can be changed in the blink of an eye. And with other habits, they take practice. So it may take multiple treatments, or sometimes a person, one treatment, and they're fine.
How do you determine, because you mentioned earlier that acupuncture could be good for physical as well as mental disorders. How do you determine whether a person is a candidate for acupuncture?
Well, people call. And what I do is I offer complimentary consultations. So if a person wants to talk to me on the phone, I'll answer all of their questions. Some people make an appointment then. Other people want to come in and have a consultation, and I talk to them about acupuncture in more depth. I often will do a point in the hand, which we're going to do later with you. And so they can decide. Acupuncture isn't necessarily the answer for everyone, but acupuncture has helped millions of people over thousands of years.
Who are most of your clients?
Still, the majority of people come to acupuncture for physical pain. Back pain, shoulder pain, neck pain, knee pain, hip pain, headaches, irritable bowel syndrome, any digestive issues. And now more and more people are coming to acupuncture for other things, like depression or fatigue. I've had people come because they've experienced great loss in their life, and they can't move forward in their life. And acupuncture is all about movement. It's about keeping everything moving. And so it's basically when a person is stuck and uncomfortable in their life, generally acupuncture can be helpful.
Does it take one session or does it take 20 sessions? How long does it take, or is it depending on what the actual situation is?
Yes and yes. I mean, I've had some people come in, and generally it's been men who can barely walk because of back pain. I do a treatment, they walk out feeling great, and I never have to see them again. So it depends on the person and their circumstances, and different people have different issues. Some people come in for maintenance treatments so that they stay nice and level because of the pressures of their lives. I mean, a lot of people have a lot of pressure from family, pressure from work, just pressure from our culture. And so there are people who come in just to stay well. What my patients tell me that they find that works is to come in once a week until they feel better. Once a person feels good for a week, then I don't want to see them for 2 weeks. Once we get them to hold for 2 weeks, some people choose to come in on a maintenance level that works for them. That might be once a month, once every 8 weeks or 6 weeks, or every, once a season. Other people only call me when they have a problem. So it can be months, if not years, between treatments. For quite a long time, I treated a woman about once every 4 years. She had knee problems. She came in, I think, 4 times. She went away. Her knees felt great. She called me 4 years later. I treated her about 4 times again.
Was her body different this time? Does the body change from treatment to treatment?
Yes, it does. In fact, people often say, well, are you going to do the same thing every time you do a treatment? And no, because every time a person comes in, they're unique. We are constantly changing. And so what we do in acupuncture is we tend to read pulses on the wrists, and those pulses tell us what organs need some treatment. And we treat those organs, and we can treat directly where pain exists as well.
Do you have people who are using the acupuncture along with traditional medicine, or do you see a bit of both, where they're using acupuncture alone or combination? I
see both. I get a lot of referrals from physicians and nurses. And so there are people, they're physicians, and there are people who want to avoid surgery, for example. And it's not uncommon nowadays for a physician to say, why don't you have acupuncture, to see if acupuncture can help you either prolong, get you better so you don't have to have surgery now, or you might not ever have to have surgery. And so I work with people while they're seeing their physicians. I work with people who, for example, either their physician or they want to cut down on their medications. I can't give advice about medications, but I can work with a patient and their physician on them lowering the amount of medications that they need. And there are a lot of people who come without consulting their physicians.
Through your years of practice, have you noticed that people have become more open to holistic medical remedies than they were, let's just say, 20 or 30 years ago?
Absolutely. More and more people know about acupuncture. When I first started practicing almost 20 years ago, people were surprised. In fact, people would say, oh, that means you study the stars? They thought I was an astronomer.
Yes.
And so, it is much more common nowadays, and yet there are still people that are unfamiliar with it. People used to say, oh, that's New Age, and it really is not New Age, it is actually Ancient Age. So it's used more and more, it's being brought into more traditional medical facilities than it was before. And people are working in conjunction with each other much more than they had in the past.
What do you think a person's main fear? Would you say that the main fear with acupuncture would be the use of the needles?
It certainly can be. I mean, I've certainly had people say, oh, I don't want needles. And people are generally very pleasantly surprised, because if I had to take your blood or give you a shot, I probably would not be doing this work. It is very different. The needles are different. They're generally very gentle. And so it's not like getting a shot or giving blood.
That's very reassuring
It's
because I hate getting a shot or getting needles.
And you know, I mean, when I go and have my blood taken, I'm like this too. But what I do is very different. And and I can also, acupuncturists can also treat people without needles. We just use some different techniques and some different tools. For example, when I treat children, I don't tend to use needles, depending on...
So children
Yes.
can get acupuncture,
Yes.
acupuncture treatments.
Absolutely. And what I do with children is generally I have the parent come in, and I teach them acupressure that they can then do at home.
So how does that work, acupressure?
Well, for example, rather than using a needle, you just use gentle pressure. And, you know, when say a person has a headache and they do, oh, I have a headache. Well, they're rubbing here. They're bringing energy here. They're bringing warmth. They're bringing pressure, which oftentimes can relieve a headache. Or they do this. You know, again, they're bringing that warmth. And we know that warmth promotes blood flow. We tend to have physical pain due to lack of blood flow, and blood carries oxygen. When blood becomes constricted, that means a portion of our body can't get oxygen, so it can't breathe. What acupuncture does is that very, very tiny needle causes a small trauma. And the body automatically then sends blood and oxygen to that area of the body so that the tissue can breathe. Once the tissue can breathe, either the pain is lessened or it goes away completely.
One pleasant surprise that acupuncture that I've heard it can help with is infertility. For some women, that it is an extremely, extremely horrible roller coaster ride. I know 20 years ago when my husband and I first tried to have children, oh boy, we went through a lot. And I had no idea that something like acupuncture may have helped. We ended up having 4 children, so everything worked out
Good.
well. But I didn't know that that was an avenue I could take.
It is, and that's one of my specialties. In addition to alleviating pain, I enhance fertility. And what I've learned in my work, anything we're meant to do, like breathing, anything we're made to do should be comfortable. And with women, for the most part, we are constructed, we're made to conceive and produce children. And so when it doesn't work, then there's some kind of blockage someplace. And generally the women that I treat have already been to physicians and they found out there's no structural issue that keeps them from having children. And so what I do is I treat them to be in as much balance as possible so that their body can do what it's made to do. And I also work with them in regards to stress and sleep. You know, many women work now and have very demanding professional jobs. And so, you know, they're giving their energy to their work, to their family, to their friends, and very often women are just really tired from the inside out. And the body then is not going to have, you know, the oomph it needs to conceive and carry through a pregnancy. And so I work with women from, you know, to get their body balanced, and very often I work with my moms all the way through pregnancy, and I also treat them afterwards to help them recuperate faster.
How successful has that been for you?
I have probably over 300 babies attributed to my practice, some with multiple children, up to 3 or 4 children, some multiple births as well.
That is absolutely wonderful.
It's a lot of fun.
That's absolutely refreshing for women out here. Like I said, it is a roller coaster ride that I never imagined.
It's and women, until they get into the process, and I didn't go through the fertility process myself, but it's very demanding. You know, depending on which process you're going through, you may have to go in every day for a shot, or give yourself shots, or have a blood test every day. And it's not simplistic.
And the medicines, those hormones, they make you feel like you're crazy.
Right.
The
Exactly.
emotional ups and downs.
And so a lot of women who go through fertility, through a fertility clinic, come for acupuncture as well. And it helps them to get through that process, that emotional and physical process, in a more comfortable way. I also have worked with a lot of my moms to induce labor, and I've turned babies as well. So, and sometimes people come to me just for those two things.
Well, have you found that the insurance companies nowadays are more receptive to acupuncture, to covering something like that? Because
Yes.
I'm sure folks are concerned with, okay, this sounds great, but how much is it going to cost me?
Well, yes. All of the carriers include acupuncture. It's whether a person's particular plan includes acupuncture. And there are hundreds of plans under each carrier, whether it's Aetna or United or Blue Cross. And so it really depends on what the employer has chosen to cover. And so I always recommend that people call their insurance company for them to hear directly if they have coverage for acupuncture, and then I always verify if they have a copay or a deductible or, you know, any particular limitations. Some plans only cover for very specific things, and other plans are pretty open. So it depends on each person's insurance.
Let's go back a little bit. What made you decide to go into this?
Well, this is my third main career.
Okay.
I started out in teaching, which when I was a young woman, it was nursing or teaching, basically. But I really wanted to have a business, but I was discouraged from that. So I went into teaching. My family, I come from a family of teachers. And then I went into technology. I lived in Silicon Valley at the time. So I worked for Lockheed, and then I worked for IBM, where I met my husband. And then I decided I wanted to get back in working with people rather than machines. And I was looking for a way to do that. And actually somebody gave me a book to read, and it talked about acupuncture. And I thought, well, how hard could that be? You know, you're just using tiny little needles, and I'd never had acupuncture. But I became enchanted with the concept. It made sense to me. And we lived in Florida at the time, South Florida, and we moved up here for me to go to school to get my master's degree in acupuncture. Fell in love with this area, and we've stayed.
What are you most proud of when it comes to your practice, your business with acupuncture? What area are you most proud of?
I'm awed every day about how amazing our body is. And that if you touch the right thing, everything can change. And that it's an honor for me to be a part of a person's health and to see them going from people who are at their wits' end sometimes or beside themselves to being back in charge of their lives. My real goal is for a person to be in charge of their life. We can't fix everything and we can't cure everything. But when we're in charge of who we are, then those things that had been huge problems before can be less significant.
That is so very important. I had an Oprah light bulb moment with that. That is very important. Things don't have to be perfect, but when you feel like you have control over your life, it makes so much of a difference.
Right. It's just, you know, and to see that shift in people and for them to realize, you know, the mammoth steps they've taken in their life you know, whether it's in how they feel about themselves or making changes. Very often people, you know, aren't sure how to make changes. And so I work with them because in my work, everything has to do with the seasons. Every season has a meaning. And everything that an acupuncturist does has to do with our organs. Every organ is significant and has a bigger job than the physiology in the body. It has an impact on the outside world as well.
Well, let's do this. Let's take a break.
Okay.
When we come back, you'll do a demonstration of what you do.
Great.
Okay?
All right.
You're watching the Sisters for Fitness Wellness Show. I'm Stephanie Gaines-Bryant. We're talking to acupuncturist. I said it right this time.
Yes, you did.
Acupuncturist Colette McKie. We'll be back right after this. Hello and welcome back to the Sisters for Fitness Wellness Show. I'm Stephanie Gaines-Bryant. Our guest today is Colette McKie. She's an acupuncturist, and we're getting ready to do a little bit of a demonstration. So what are you going to demonstrate to us today?
Well, the first thing I'm going to do is show you how an acupuncturist reads pulses. Very often people ask, gee, how do you know what points to do? And reading pulses is one way for a person to know, for an acupuncturist to know what points to do. We listen to our patient telling us what they're experiencing. We also read their pulses. So if I can just hold your right hand.
Absolutely.
And just let your arm be at ease. And take a nice deep breath and exhale, and then just breathe normally. And what I'm doing is I'm reading 6 pulses, and I would read 6 pulses on each wrist, and each pulse relates to a channel of energy in your body called a meridian. Those are the rivers in your body that we talked about. And each meridian is associated with one of your major organs. Everything that we do has to do with the organs because they are what make everything work. And I feel for how are the organs the same and how are they different?
What are you detecting so far?
They feel pretty darn good. Ideally, the pulses feel like a garden hose that has water running through it, so that if you stepped on that hose, it would push back. Very often in our culture, people are so tired that you can feel the pulse, but then you can push through it. It's like a garden hose that has no water running through it. So that tells me that that organ is tired and it needs some support. And that's what acupuncture can do. Or an organ can be overworking, trying to compensate for the lacking of another weak organ. And so it's overworking and you can feel it. It's like a garden hose that has a kink in it and it's building up pressure. And so that tells me to give that some relief as I build up another organ.
Based on what you've just done, what type of acupuncture are you going to try now? What are you going to do now?
Well, you were interested in knowing what the needles were like.
Yes.
And how it feels.
Yes.
And so I've already used a little bit of antiseptic on your hand.
Yes.
And my hands are clean.
So I'm all clean.
Yep. And so I have a needle, and again, this was taken out of a sterile package. It's very, very thin.
Very thin.
It's very thin. It's hair thin. And the handle is for my use. And so I'm just going to gently touch your skin. I'm going to feel for the point. And once I find the point with my finger, I'm going to ask you to take a breath, and it can be a normal breath. And then as you exhale, I'm going to barely put the point into your skin.
Okay.
Okay? So take a breath and exhale. Ta-da.
Wow.
Now, that particular point is a point that could be used to help a person if they have a headache, if they have a toothache, if it can be used for a person who is anxious about an upcoming engagement, a speech or something. I've had patients rub that to help lower anxiety. It could be helpful for a person who's experiencing diarrhea or constipation.
But I guess the next question would be, what would a point in the hand have to do with a headache or a toothache?
Well, what the Chinese discovered, in which our science is continually rediscovering as well, is everything is connected. And so that particular point is an important point of the large intestine. And in Chinese medicine, the organs don't just have their physiological jobs, they have their jobs that impact our outside world as well. And so I treat people for all kinds of things. For example, if a person is having trouble sleeping, the liver might be involved. If a person is having, they say, oh, I used to be so creative and now I'm just not creative, I might treat their liver as well, because the liver has to do with creativity. And so there's so many layers of us that the Chinese over thousands of years, remember, they didn't have faxes and highways and electricity. They had to figure out how to survive in a very harsh world. And they had all the time in the world to observe what the cause and effect of things. And so, for example, this point can be used if a person is in deep grief and can't pull out of that grief.
Interesting.
That point can help them move through that grief to the other side.
What would your best advice be as we're wrapping up the program today? What would your best advice be to someone who's on the fence, who finds what you're saying extremely interesting, but they have fears?
Well, you might talk to people and see if you know anybody who's had acupuncture and what their experiences are. Again, acupuncture is not the answer for every person, for every situation, but it's helped millions of people over thousands of years. So talk to people who've had acupuncture. You can call acupuncturists. When I have a patient who's moving to another area, I recommend that they contact 3 acupuncturists, talk to them on the phone, and if you feel comfortable with someone, ask them if they offer complimentary consultations like I do.
Okay.
You can go in and chat with them and decide to move forward or not.
Well, it's been an absolute pleasure. Thanks so much for joining me today. You've been watching the Sisters for Fitness Wellness program. I'm Stephanie Gaines-Bryant. Our guest today has been Colette McKie, and she's an acupuncturist. We'll be giving her information at the end of the program. Thank you so much. Have a great day.
Thank you very much. I've loved being here.